Who's to blame when poor countries can't get the COVID vaccines they need to protect their people? Are rich nations hoarding supplies, or are they right to look after their own people first? This is Roundtable. Good to have your company. I'm David Foster. It is about priorities, says the World Health Organization. Get the vaccines to those who need them most right now, it insists, and look after the less vulnerable at home later. Richer nations are under fire from the World Health Organization and UNICEF for hoarding and over-ordering vaccines. A moral catastrophe, the WHO called it, urging wealthy countries to donate doses rather than use them for children who are less vulnerable to severe disease.
There is no diplomatic way to say it. A small group of countries that make and buy the majority of the world's vaccines control the fate of the rest of the world.
High and upper middle countries represent 53% of the world's population, but have received 83% of the world's vaccines. By contrast, low and lower middle income countries account for 47% of the population, but have received just 17% of the world's vaccines. Despite the urgent call for global vaccine sharing, EU Commission President Ursula von der Leyen announced earlier this month that the bloc will not share coronavirus vaccines with other countries until it has, as she put it, a better production situation in the European Union. With pressure mounting, will wealthier nations start to share more doses? And what will happen if they don't? Well, I'm delighted to be able to say we can go to Oxford first of all for this round table. We see there Robin Cohen, Emeritus Professor of Development Studies at Oxford University. Then in London we have Sridhar Venkatapuram, Senior Lecturer in Global Health and Philosophy at the King's Global Health Institute, and then to Switzerland, to Basel to be precise. Thomas Cueni waits us there, Director General of the International Federation of Pharmaceutical Manufacturers and Associations. Thomas Cueni, let me come to you first of all. I watched you on a British television programme the other day saying it's not true that people in developing countries are left stranded. How do you arrive at that conclusion when half of the world's population has got 80% of the vaccines and the remaining 17% goes to those that are left over?
That was clearly before we had the Indian emergency, because over the last few weeks, one fact changed, because COVAX, the joint program of WHO, CEPI and Gavi, was relying very much on AstraZeneca Oxford vaccines coming out of India, and because of the emergency in India, nothing is leaving that country. But even now, I would say that the situation is uneven, and we did last week call out for 5 steps to address and urgently improve vaccine equity. The first one is rich countries need to start dose sharing. And we actually, last Friday at the World Health Summit in the context of G20, we saw that starting. We had President Biden last week announcing that the US wants to start dose sharing before the US vaccinated everyone. We have seen the European Union making a big commitment. And in particular, we saw 3 major vaccine manufacturers announcing 3.5 billion doses, almost half of it this year, half of it next year, going to low and middle income.
Can I throw that to one of our other guests, to you, Sridhar, first of all? Do you think Big Pharma now, having done what Thomas Cueni says it's done, is doing enough?
Absolutely not. I mean, I think that to say that the vaccine distribution is uneven is such a really inadequate description of what's going on. I think it's sort of 80 to 90% of the vaccine doses that have been given in G20 countries, while the rest of the human population living in LMICs don't have access to the vaccines. Is to say it's uneven, I think, is a gross mischaracterization of that. I think it's just disrespectful of the situation. The second thing is that the Global Health Summit that happened last Friday was a phenomenal event, mostly because this was a response to the US asking for patent waivers. And what we have is essentially pharmaceutical CEOs lining up to say they promise to produce these doses and then distribute them to LMIC. So that's a pledge. It's not a real this is what we are going to do tomorrow. It's not going to be something that we promise, but it's something of a promise. And what we know about promises is that they don't get kept. So just a year ago,
I'm going to stop you there for just a moment and tell Thomas that we will come back to you on that, because I believe you are against the waivers, getting rid of the patents for the time being. We'll give you the right of reply on that one. But Robin, I want to bring you in at this particular point. Do you believe there is hoarding?
Well, I think there certainly is hoarding, and I think I would agree with our first contributor that the Serum Institute issue is extremely important. We have lost probably about 100 million doses that were due from the Serum Institute of India to COVAX and to other countries, and I'm afraid that just hasn't materialized, partly because of a fire that happened last March, which was rather covered over in the publicity, and also because of the desperate needs of India. So what has happened is, because we haven't had that, the practice of hoarding, which has been happening throughout really, and now looks very much more stark and very much more unacceptable. I think it's desperately needed that people start to share on a larger scale.
So can I bring up these four countries: Canada, UK, European Union, obviously not a country, and Australia, and read out some figures. Canada, 338 million doses, enough to vaccinate the population 5 times over. The UK, enough to vaccinate the population by 3.6. European Union, 2.7. Australia, 2.5 times the population could be vaccinated. Well, apparently you only need 1 dose until we get some boosters. So why do you think, Robin, that these countries are doing this?
One has to start by saying nobody knew exactly which vaccines would work and which would pass regulations. So you can't really blame the people who ordered them in the first place. But now, when it is quite clear that there are an excess of doses that are not needed and perhaps won't be required and may even expire, so we're talking about real wastage here, we really do need to accelerate the program of sharing. Bear in mind that COVAX essentially was a purchase agreement, and the redistribution really hasn't happened to any great extent.
So how do you go about the process of sharing? And I'll stay with you for that one, Robin, then go back.
Well, I think part of the problem is that all kinds of things are confounding this. So it's not just based on need. It's also based on what is sometimes called vaccine diplomacy, helping one's neighbors or influencing countries that you may wish to influence. So you are finding a certain degree of irrationality that is going on. And we need the World Health Organization and the bodies that support COVAX to come up with a good sharing scheme that is very rational, as well as the purchasing scheme that we've talked about.
Thomas, you were nodding in some kind of agreement with which particular parts of that argument?
With many of the arguments Robin made, because it's clear. I think one needs to differentiate between hoarding and the pre-orders made, because indeed you have the US, the European Union, UK and Canada, each and every one of them did advance purchase agreement for between 5 and 8 doses per citizen. But that was at the time. If you would have asked me a year ago, who would have thought that Sanofi, Pasteur, GSK wouldn't have come up with the vaccine by now, that Merck and Co., one of the largest vaccine manufacturers, wouldn't have a vaccine. Therefore, what we have to realize, this was sort of precautionary. And those countries don't have these vaccines yet, because when we look at this year, we need about 11 billion doses, and I'm cautiously optimistic we may get these 11 billion doses, which is 3 times the manufacturing of vaccines pre-COVID-19, 11 billion just for COVID-19 alone. But the other element is also COVAX, and we are partner of the COVAX, IFPMA and our member companies. Initially, they suffered from, I think, two challenges. One is they were not able to sign contracts because they didn't have the money early on, so that the US, UK, and others were faster. Second, COVAX was betting on cheap vaccines and vaccines with logistic requirements, which wouldn't have required ultra-cold chains, and therefore they missed out early on the mRNA vaccines, which really were the game changers.
Okay, stop there if you don't mind for just a second, because I want to go to Sridhar, and you were nodding at some points, but I'm not sure you agree entirely with the argument you've just heard.
We need to be accurate here about the description of the facts, which is that all these rich countries placed orders for the numbers that you were talking about, which, if fulfilled, would then, vaccinate the entire population multiple times over. So there is no disagreement here that countries purchased much more than they needed because they were, betting and sort of hoping that one of the bets will pay off. I think what the attention needs to do in terms of hoarding is right now, Canada, for example, is sitting on 600,000 doses of AstraZeneca vaccine, which they are still, waiting to approve on the use or not. That in itself, if it's going to happen before they expire, we don't know. But those doses could be used to save 600,000 lives elsewhere. So in a similar way, there's lots of questions about which countries have doses right now that they do not need that could be shared to other countries. And there's also a second issue that the rich countries are vaccinating people at very low risk compared to people that have much higher risk in LMICs, that their lives could be saved if you share those vaccines. Then there's the question about the future, is that are we going to let these rich countries get their orders and then decide how to allocate them according to their national interest or some other formula? Or are we going to say, actually the manufacturing capacity in the future, despite you placing orders, actually it should be geared towards LMIC countries, and here's how we're going to do it. The other point, more fundamentally, is that this is all because this was a project that was driven by this idea that countries buy through COVAX, but the rich countries actually sidestepped that, is that they put money into COVAX, not enough, but just enough, and then they made side deals with these companies, which has now resulted in the position that we're in now.
Is that simple prudence or is that immoral?
That is unethical, right? So we were supposed to work on this in terms of a global project. It's a global problem. We are going to work on this, and we're going to pull together a COVAX facility in order to address this. Despite agreeing on the one hand to do that, they then went around and essentially undermined that whole project by making deals directly with the pharmaceutical companies. That is, you could say that it's immoral in the sense that it was a global project based on solidarity, based on the equal value of life, which then they sort of sidestepped and actually said, no, we're going to put our national population first and we're going to buy directly.
Okay,
now, the US,
I'm sorry, I want to move the conversation around.
Yeah.
Give
Sure.
everybody a fair share. So Robin, I was interested to read one of the things that you told our producers, and that you believe that countries with a surfeit of vaccines are actually using that extra capacity in some form of blackmail or leverage with other countries.
Well, I don't want to generalize and say every country is in a situation where they are doing that, but I would say that the issue of national interest, which has been raised already by our last speaker, is very evident. So, the United States hasn't yet authorized AstraZeneca, unless I'm out of date. They have AstraZeneca doses, so they are taking them to Mexico, naturally enough, and why not? But there's obviously a kind of political interest in trying to keep sweet with one's neighbors. In the case of Russia and in China, the vaccine diplomacy is much more aggressive, and it's definitely a means of seeking to secure influence in the longer term with countries that they wish to bring into their orbit of influence.
Could this issue of the hoarding, if you want to call it that, be ended if the patent protection waivers were got rid of? If poorer countries were able to sort of jack up production themselves and be told how to do it and learn how to do it and produce these drugs at a very, very much reduced cost. The waivers would have to go. Do you think that would help enormously?
Well, I do think we need to address this in the short term and longer term. In the short term, I don't think it will make very much difference. I know it's a very unpopular thing to say because it seems intuitive that if you're interested in justice, you're interested in sharing, including patents and intellectual property. But there's so much more to making a vaccine than simply waiving intellectual property rights. In the long run, that would be very helpful to share intellectual property rights or to ensure that they were given on a cost basis, as AstraZeneca does. But I think the more immediate issue is sharing, for example, doses that might now be targeted to pediatric use, children over 12. And I don't think that's a huge priority. I think it's more important that we share immediately.
But it is a very controversial point, as you say. And Thomas, I want to come to you and quote something from the Pharmaceutical Research and Manufacturers of America group, Pharma, PHRMA. I don't know whether you agree with this, but they say getting rid of those protections would undermine the global response, undermine public confidence. Most importantly, eliminating protections would not speed up production. Now, I can see why in the short term that would be the case. But as Robin suggests, in the long term, why not waive these rights so that the poorer countries can get on with it at a much cheaper way than you can?
I think first what we need to realize, this is not about us defending IP. If, waiving IP would lead to immediately removing the problem, I think we wouldn't stand a chance. We wouldn't have Chancellor Merkel from Germany and many others siding with us. I think when you talk to experts from vaccine manufacturing, each and everyone will tell you what needs to happen is scaling up manufacturing. What needs to happen, and Robin mentioned that, you really need to share know-how, knowledge, technology transfer. The IP waiver would probably disrupt more than help, because what needs to be done in addition to dose sharing immediately, we need to tackle trade barriers. For example, Serum Institute was hit hard by the Defense Production Act in the US and disruption of supplies to their plants in India. We need to improve on efficiency because the scarcity by and large is raw materials. Therefore, short term, the waiver would not help with anything, except we have seen over the last year almost 300 partnerships, contracts between companies. More than 200 of them include voluntary licensing, voluntary tech transfer, voluntary know-how sharing. When you talk to Indian vaccine manufacturers or US or European, their concern is scarcity of skilled workers, it's scarcity of raw materials. It is concern about quality, about good manufacturing practice. And just over the last few weeks, we saw hearings in the US. Why have 15 million doses of the J&J vaccines been destroyed? Because one of the most seasoned contract manufacturers was apparently not up to the job required.
And is it because of this, sorry, Thomas, is it because of this, Sridhar, that you think the G7 nations who are having a summit meeting next month, happens to be in the UK, that they will not back the idea of the patent waivers?
It's very clear that the Germany and the US as national governments have a very strong interest in protecting industries and the companies that have produced these vaccines. So the three vaccines that are most prevalent, so you have J&J, AstraZeneca, and Pfizer. So Pfizer-BioNTech is German money that the German government gave 750 million euros or something like that. And then the US put in $18 billion into various pharmaceutical companies. So at this point, the idea of trying to then undermine those companies by varying their patents doesn't make sense. But what we have when the U.S. government said that it was going to support it, gave a signal from the U.S. that the other countries and companies need to do something to make the situation better. And to a large extent, it has worked. So last Friday, you have a significant move by companies and governments to increase their manufacturing and produce these doses. So I do think that the patent waiver support by the US has two reasons. One is a purely political negotiation tactic in order to make the situation worse. But the second thing about the patent waiver, if it's true, what's happened is that no matter all the partnerships that have existed already, it just simply isn't enough. We need to increase production of vaccines that are effective in order to save lives. What is currently existing isn't working, so we need to ramp
and for
that up.
For that extra funding will be needed. Let's hear from Antonio Guterres, the UN Secretary General, on that matter.
By now, COVAX should have delivered 170 million doses around the world. But due to vaccine nationalism, limited production capacity, and lack of funding, that figure is just 65 million. I call on G20 countries to lead by example and contribute their full share of funding. An investment of billions could end up saving trillions and saving lives.
So, Robin, he's saying we need more money. Is there any way of putting pressure on these G20 countries to which he refers to cough up?
Well, I think we'll see at the G7. That will be the signal. But I want to agree with my colleagues here that there's so much more that can be done in the meantime. You know, glass vials need to be produced, little needles need to be produced, fill and finish operations can be undertaken or set up, means of delivering vaccinations, training vaccinators, setting up vaccination sites, exploring whether there are freezer facilities and so on. So before you get to the point where you need to switch IP agreements and assume that everything will be okay, move where you can move. And that's what I would urge people to do.
Okay, so let's throw that one to you, Thomas. I will postulate that Big Pharma's making a lot of money out of all of this, though perhaps not as much as some people will have suggested. Will you be able to follow up, recommend to your members the sort of thing that Robin's just mentioned?
Actually, we have done so. You know, since in March last year, we did say that this requires an unprecedented response, partnerships, sharing of know-how, even sharing of capacity. We see it on a large scale. We have pharma companies who are now working with other vaccine manufacturers to scale up manufacturing. We co-convened earlier in March a Chatham House roundtable when everybody started to realize that the scarcity were the glass vials, were the syringes, were the filters, the RNA, the lipids you need to encode the mRNA vaccines. And this is happening. Actually, when you look at Pfizer, BioNTech, end of last year estimated that this year they would come up with maybe 1.3 billion doses. Right now, they are optimistic that they will be able to manufacture 2.5 billion doses and actually privately admit, we hope that we will be able to make 3 billion doses.
I'm going to go to Sridhar because we've only got a few minutes left. What else do you think that people such as Thomas can do or recommend to their members to help with this?
Well, I think that, as he said, there's a lot that still needs to be done. There's some things that have been done, but what we need is essentially the rich countries have the vaccines that they need, and now they're moving it into a charity model, which is that they're deciding how much money they should put into COVAX, how much they should give directly to countries, how many doses they should give countries. And what we need to do is move away from that model. And it would be fantastic if Thomas's organization could stop producing or supporting a charity-based model towards getting vaccines to people all over the world and start thinking about it more as a globally interdependent society. And they, as an association of pharmaceutical companies worldwide, need to see that they're making they're not making iPads or opera tickets. This is a fundamental issue around life, and that they need to move states as well as their own.
Thomas, I'm going to leave you to digest that because we don't have enough time to get a response, and I want to get Robin back in. Will it always be the case, do you think, sadly perhaps, that the rich countries will have one over the poor countries, even when it comes to a global health emergency?
I think that's obviously the fear. But what is working in the opposite direction, of course, is the growth of variants in poor countries, which rich countries need to protect. Ultimately, we all are all bound together. There's travel, there's migration, there's trade that unites us. And so I'm much more optimistic that we can look to a world in which vaccine sharing and similar kinds of health initiatives can be done on the model that Sridhar suggested.
And if you don't share, if people don't get the vaccines they need in different parts of the world, it presumably just sort of follows that the variants will spread.
That's the fear, of course, and we're never going to get rid of it completely unless we're able to intervene where the variants are popping up and where there is need. And so it's absolutely all about rationality, not about protecting one's population in the short term, but protecting the world in the longer term.
One final thing, if you wouldn't mind, Robin, I noticed at the bottom of the notes it said you think part of the problem could be solved if instead of injecting the vaccine, we got some kind of nasal spray for it. Is that at all possible?
That's of course, Thomas would know a lot more than I do about this, but there's definitely a lot of research going into both whether you can deliver it through pills or through nasal spray. And of course, that would make a huge difference.
Okay, quickly, final word, Thomas, if you don't mind, will that happen?
We may, but I'm not sure, because we have had approaches to nasal flu vaccines. Didn't quite work out. Therefore, I wouldn't bet on it, but I think we have seen amazing progress.
You are being a very sensible man by not putting your house on it. But listen, thank you very much indeed to each and every one of you. Fascinating to listen to your perspectives. We appreciate you coming on the program. For me, David Foster, that is it for this roundtable. We hope to have your company next time. Until then, goodbye.